alopecia. Next few terms, we're going to be talking about hair that's either going away or appearing where you wouldn't expect it to. The first one we're going to deal with, we're sort of reflecting back on that last slide from the previous lecture segment, trichotillomania, when we talked about intentional hair loss due to a compulsive disorder. In this case, this is hair loss that's unintentional, alopecia. Hair loss, especially on the head, otherwise known as baldness. Two forms that we're looking at here on the right. The top photo shows what we call typical male pattern baldness. So at a certain age, with the changes in the body, hair loss starts to set in, and there's different ways that it presents. But typically it happens from the vortex, meaning the peak of the skull, on down, as we see in this situation. The other one we see in the lower picture on the right is a different form of alopecia. I'm sure there's a specific term for it, but I've never worked in derm. I did have a student who had this particular disorder when she was, I believe, in 7th or 8th grade. So in middle school, she suddenly lost a bunch of hair on the side of her head, and she had a huge bald spot, she said, about the size of a softball, which you can imagine in middle school was probably terrifying for her. She did see a physician. It did eventually resolve. It took a while. And I don't know if she ever really found out why it happened. It simply did happen. I'm guessing a dermatologist could probably give you lots of information about how and why that disease state could occur. It's pretty rare, but we do see it pop up every once in a while. I've only ever heard of one case, and it wasn't a patient. It was a student who shared her story with me. And on the subject of hair appearing where we don't expect it to, typically, at least by our social mores, we have hirsutism. This is a condition of unwanted hair growth, especially in women. So it is potentially, on the patient's behalf, unwanted hair growth. Socially, we see this as being abnormal on women, although to be honest, we're all humans, and perfection is not a quality that we associate with being human. In this case, because typically of hormonal changes later in life, especially approaching menopause, or maybe some other form of hormonal imbalance at any point in life, facial hair may appear in women, and depending on your culture, this may or may not seem abnormal. In the West, especially in the United States, we consider it to be abnormal, but there are places in the world where it's considered to be just what it is, and no one worries about it, or notices it, or even, so much calls attention to it. So it's kind of cultural. It is medical, because we do know that typically women do not grow facial hair. However, once again, whether it's a medical condition versus social condition kind of depends on what culture you're in. Whether it needs treatment or not would be treated the same. Here's a combining form, pretty simple one, SIBO. It means sebum or sebaceous, as in sebaceous gland we mentioned earlier, and here you see another sebaceous gland. This time it's not called a sweat gland. Sebaceous means pertaining to sebum. Seborrhea means excessive secretion of sebum. So let's clarify what sebum is. It's the oily substance secreted by the sebaceous glands that helps prevent hair and skin from drying out. Excess sebum often causes acne. So that explains the acne you had in your teenage years, if you had that. Most of us did. And so it was just overproduction of sebum, and it caused a skin disorder that manifested itself in terms of acne. And we'll actually talk about acne a little bit later. The thing about sebum is it is absolutely necessary to have this oil on our skin and in our hair. It keeps things from drying out, which always makes me think of our modern cosmetic industry, which has us take products, like take certain shampoos and things that strip the oil out of our hair, and then we buy another product to replace the oil back in our hair. There are certain cultures and beliefs that say that washing the hair shouldn't happen on a daily or even in some cases a weekly basis because the sebum is good for the skin. It depends, once again, on cultural mores. But I always thought that's the great irony with Western cosmetics. They often give us things to strip oils and things off of our skin, and then we add things with lotions and conditioners back in, when our body produces it naturally all along. So one of those great mysteries of life in Western culture and other cultures as well that is really unanswerable, simply an observation on my part. Cirrho, this is going to be the condition of dry, and xeroderma is a condition of dry skin. That can be a condition, and if we do have it, it's called cirrhosis. This is a condition of abnormal dryness. Usually topicals work just well for this. Sometimes it's acute, meaning it's short-term for whatever reason. Sometimes it's chronic, and you deal with it your entire lifetime. Pyo is a term that we use to describe pus, as in pyoderma, a skin condition containing pus. So pus usually means infection or post-infection. As you can see here, this person had some sort of acne that resulted in some sort of minor infection. And you can see in the picture that there is some pustules there. And so that's what we're talking about when we describe pyoderma. It's, I guess you could say, a form of acne, although pyoderma can appear secondary to trauma or other conditions as well. So it just kind of depends on what you're looking at. But generally, that's what we refer to it as. Cryo. This is a combining form that means cold, as in cryotherapy, a treatment using cold, or cryosurgery, destruction of tissue using cold. In this case, maybe some of you have had this experience before where you've had a wart or something burned off using gas in a canister in your doctor's office, where they had liquid nitrogen, which has a very low boiling point, and we put it into a container, and we use a little device like you see in the picture here, and we actually burn the skin with a type of cold. So technically we're freezing it, but it ends up being like a burn. The result is you'll have an area that will blister, and a few days later that blister will fall off, and the wart or the skin tag we're trying to get rid of, or the skin lesion we're trying to get rid of, will go with that skin as the blister breaks, and the idea is it doesn't come back, and sometimes it actually works. So maybe some of you have had warts burned off using this and found out that within a year or so you had the wart again. But there are times when this will effectively remove it forever and you never have to deal with it again. So that's cryo and cryotherapy and or cryosurgery. Kind of the same thing. All right, combining forms for color. We're going to run all these down. There are many combining forms for color in medicine. We're going to teach you the most important ones. The others you'll probably run across in your adventures of your further education or in your careers when you get there. So albino means white. Cyano means blue. Erythro means red. Leuco also means white. And melano means black. So those are the colors we're dealing with. Let's show you how they work. So in the term, using the terms albino or leuco for white, we have two different ways we use this. So we take the term albino, attach ism to it, and we have albinism, meaning white condition or condition of white. This is caused by the lack of melanin pigment in the skin, hair, and eyes. So you've probably heard of this condition. There's a photo of it in the upper right corner. The skin just lacks pigment. It can happen with any skin color. In other words, I've seen African Americans who have a case of albinism. It doesn't really matter what the original skin color would or be assumed to be. This is just a case where the melanin does not pigment the hair and the skin, and therefore it has this pale, almost translucent look to it. Versus leuco, and leuco is used a little bit differently, as in leukoderma, which is another condition of white skin. Vitiligo is another term for it, and we're going to get to that on the next slide, and I'll show you what vitiligo looks like. We could have leukocytes. These are white blood cells. The abbreviation is WBC. And we have leukemia, white blood. This is a disease characterized by excessive production of immature white blood cells. So white blood cells are very important to many functions in our body. If you produce a lot of them, but they never mature into full white blood cells, then you have a compromised immune system. You may have some blood clotting disorders, and these are components of the disease leukemia. So that's, of course, a condition we want to treat and ultimately want to prevent. Vitiligo, just mentioned a moment ago, a localized loss of skin pigmentation characterized by irregular milky white patches. So the two examples we see here, of course, the lower right, you probably recognize Michael Jackson, and the one above it, these are both African Americans, and I believe they must have chose these photos because it's more dramatic. Once again, this can happen in any skin pigmentation. So vitiligo, once again, you have those white patches, but they're localized. You may have seen this before. I have seen a few people around town on a semi-regular basis that have this condition, and it simply is what it is. There's no treatment that I know that can correct this condition. other than maybe disguising it with makeup. But most people I've seen with it just wear it proudly because it's part of who they are. So just so you don't get confused between the two, here's a comparison. Albinism on the left, leukoderma or vitiligo on the right. So that's the difference between the two. One, albinism, is global. It's through the entire system. And the other is localized or centralized, and that's the leukoderma or the vitiligo. Okay, moving on to one of my favorite colors, blue. As long as I don't see it on my patient, I'm fine with it. Cyano is a combining form for blue. If I see it on a patient, it's usually meaning we have a condition we have to deal with. And that condition is manifested in something called cyanosis. Cyanosis is a bluish discoloration of the skin and the mucous membranes caused by a lack of oxygen in the blood. So I'm not going to go into depth on this. When we do our cardiopulmonary week, which I believe is next week or the week after, you're going to see the word cyanosis, and I'm going to give you a lot of really good information about it, what it means, and what we do if we see it. But for right now, just understand it's a bluish discoloration of the skin, mucous membranes. If you know somebody who's in respiratory distress and you see bluing around the mouth or in the fingertips, and these photographs are exaggerated, that looks more like they dipped their fingers in blue paint. But if you do see that, especially on an infant who can't speak for themselves, it's time to probably get an evaluation because they could be lacking oxygen. In fact, likely are lacking oxygen, and we certainly want to address that immediately. So cyanosis is concerning, and as I said, later on in the semester, we'll get more information about that. Erythro, pretty straight ahead word, means red. As in, and you're going to notice the pronunciation is going to change here. I just said erythro, right? But now I'm about to say erythema, and that means redness of skin. But the next word, we say erythrocyte. It's a red blood cell. So the pronunciation, as you can tell, shifts back and forth. Erythema versus erythrocyte. And erythrocyte, once again, is a red blood cell, and the abbreviation for erythrocyte is RBC. You could have erythrocytosis, an abnormal increase in the number of red blood cells, or erythropenia, a deficiency in the number of red blood cells. Either condition is something that we need to pay attention to. That usually indicates another underlying condition, and erythrocytosis or erythropenia in and of themselves can be a bit troubling. So we see the presence of those. We want to make sure that we get proper medical attention. And I'm going to go ahead and pause here, and we'll pick this up in the next segment. And we're going to go back to discussing the term that we use for white in just a moment.